Hi, I'm Sarah and I'm going to talk about cervical screening, or how it's most commonly known as a smear test. This video is aimed to offer you some information as to why we offer cervical screening and what to expect at your appointment. Anyone with a cervix aged between 25 and 64 who is registered at a GP practice will be invited to have cervical screening. You will be automatically invited for routine screening and you should receive your first invite a few months before turning 25. You can choose to opt out of this process at any time. Most cervical screening is done at a GP surgery, often by a female nurse or doctor. In some areas, this can be done at a local health clinic or a walk-in centre. You can ask if your clinician is male or female when booking your appointment. You may also request to bring a chaperone to your appointment. The test itself usually takes a few minutes, but you can expect to be in the appointment for around 15 to 20 minutes. This is as you will be asked to confirm your details and we will discuss why we have invited you to be screened, as well as offering you time to talk about any worries or any concerns you may have. Cervical screening is not a test for cancer. We are looking for traces of HPV, human papillomavirus, and if this virus is detected, your sample will then be screened for any abnormal cells that, if left untreated, may turn into cancer. You can visit the NHS website to find out more on HPV and how this is treated.
Once you feel comfortable, the nurse or doctor will ask you to undress from the waist down, or just remove your underwear if you're wearing a loose skirt, and lie on the bed with your knees bent and apart. You will likely have a paper sheet or a towel to cover your stomach and hips. Your clinician will put a device called a speculum into your vagina and open it gently. This allows them to see your cervix. The speculum is usually made of plastic and a new one is used for each screening test. The nurse or the doctor then uses a small soft brush to take a sample of cells from the surface of your cervix. You might feel some discomfort, but this should go away quickly. If it feels painful, tell the nurse or doctor and they will try and make it more comfortable for you. You are in control of your screening appointment and you can ask to stop at any time.
You will then be able to get dressed and your sample will be sent to the lab and your results will be posted to you. The nurse or doctor will tell you when you can expect your results letter, which is usually within a couple of weeks. There are 4 possible results. If the results are clear, meaning a HPV negative result, we will not do any further tests. This result means it's highly unlikely you will have any abnormal cervical cells. We will simply call you back for screening, again in line with the NHS routine screening guidelines. If your sample is HPV positive, this will also be tested for abnormal cervical cells. If none are found, your result will say you have HPV, but no abnormal cells. We will ask you to come for screening again sooner than usual, and your result letter will explain when. This is so we can check if your immune system has cleared the HPV, which happens in most cases. If you have HPV and any grade of abnormal cervical cells, we will refer you for a colposcopy for further assessment, which usually takes place at your local hospital. Occasionally, a sample may be called inadequate. This may be due to a technical problem, for example, if the lab cannot get a HPV test result from your sample or cannot see if abnormal cells are present or not. If you have an inadequate test, we will ask you to have cervical screening again shortly afterwards, usually within 3 months. The reason for the slight wait is so that there are enough cells again to get a sample from. Cervical screening saves lives.
Don't ignore your invite. Book an appointment in your GP practice now if you've missed your last one.
Cervical screening can help to stop cancer before it starts.